it's part of a beginning education program, and I think that needs to be done more of nationally, though, too.
Well, it seems like the tools are in place for states to really control some of this cost, and yet we still want more progress. Jennifer Granholm, how much of a factor was rising health care to the, I don't want to say demise, but upset in the auto sector?
You know, Maria, a couple of years ago, Lee Scott, head of Walmart, came and spoke to the National Governors Association about the importance in a global economy of having a uniquely American solution to the cost of health care, because in a global economy, our competitor countries are providing health care to their businesses, and that puts a disadvantage on ours. The auto industry is the poster child industry of an older legacy business that has been significantly impacted negatively by global competition because of the cost of health care.
So you're saying the Japanese, the Chinese, they have better health care
They provide
costs.
They have a better cost-sharing arrangement with business. There is no doubt about it. And so we hurt our businesses. This is exactly what Lee Scott was saying. It's one of the reasons why initially in this health care debate, the Chamber of Commerce was on board with finding, again, a uniquely American solution. Now, this doesn't mean, you know, I've been listening to all of us here talking, and there's a lot of great ideas that have come from the states. I mean, here's an example. Governor Douglas and I, when we first came on, we teamed up to pool our buying power to get rebates on prescription drugs. That power of largeness is really an important way to reduce those costs. You know, everybody has agreed, I think, here that they'd like to see flexibility, that they'd like to have managed care in some way so that you don't have fee-for-service that's driving up the costs. Everybody has agreed they'd like to see the states have more impact on being able to drive those costs down, that we'd like to see the experts listen to in terms of what are best practices. People want to see transparency in healthcare IT, both from the consumer point of view as well as the ability to use IT to reduce the costs. We all agree that we want to see competition, which includes a good part of this being driven and operated by the private sector. We all agree that there should be incentives for outcomes, both for the doctors who were awarded for achieving healthy outcomes, as well as for individuals making decisions about their own behavior, that perhaps their costs are less if they engage in healthy behavior. We all agree that there should be, I think, a primary medical home that people turn to. I think we all agree about the shared responsibility that it's government, individual, and business, that everybody has to have some skin in the game. We all agree that there are creative solutions like pooling that could reduce the cost of health care. We all agree, I think, that there shouldn't be automatic denial for pre-existing coverage, and I think we all agree that it would be best if we could cover as many people as possible so that we don't jack up the cost for subsidizing those uncompensated care. These are basic principles that I think most of us could agree on and sign on to. And these are the kinds of things that could make businesses in America competitive if we were to come out with a health care plan that was a no-frills benefit plan that provided flexibility and options but didn't put the entire burden on the back of business.
Governor Pawlenty?
Well, I think the auto industry may be instructive by analogy for other reasons as well. Just to move away from that specifically, but what you had was an entire industry that over time, management and labor together, bargained up the price of their model, the cost of their model so high that it could no longer be sustained by any reasonable projections on revenue growth, and largely insulated from market forces and entrepreneurial dynamics. I mean, Peter Drucker, amongst others, studied General Motors and other companies over the decades and said, it became what used to be a dynamic industry with entrepreneurial spirit into basically a mindless bureaucracy, insulated from market forces. So I think those lessons and the ghosts of the past in that industry, hopefully better now going forward, is instructive for what we've seen in the legacy system that is large command and control, one-size-fits-all legacy systems in government, including entitlement programs and the mentality that's underneath that. We know that individual responsibility matters, markets work, price and value matters. If you give people good information with protection to shop, those kinds of things help. And those dynamic qualities are largely missing from one-size-fits-all bureaucracies. In the case of the automobile industry, they get to run to federal court and get restructured by a judge. You know, they get their pension plans restructured, their health care plans restructured, or there's some extraordinary intervention by the federal government. You know, but the states don't have the ability to do that. We don't want to do that. But I mean, how does our entitlement legacy structures get redone? It isn't going to be by a bankruptcy court, I hope not. So dramatic forces or events have to intercede, because I think we had the same legacy mentality in looking back as General Motors did or the automobile industry did.
It's a really good point. Governor Rounds.
Thank you. I think Governor Pawlenty and Governor Granholm have both hit on something that probably leads us into a discussion about what is going on in Washington with regards to the existing proposals in health care reform. The federal government finds itself in the same position, perhaps, as the auto industries have. You have a promise of entitlement programs, which I think we all recognize government can't continue to pay for. Sustainability of health care on behalf of the federal government and the required co-payment on behalf of the states is greater than what we can afford. In doing so, one of the ways in which we now manage Medicaid is by reducing the amount that we pay providers. In the upper Midwest, we reimburse at between 50 and 52% of the billed charge. Now, if a physician is getting paid 50 to 52%, or a hospital 50 to 52% of an increasing number of individuals, because Medicaid numbers are increasing, particularly during a time of a recession, you then have a cost shift onto the private sector, which then drives up the cost of health care for the other industries that are trying to employ individuals. So we now have the beginning of a death spiral with the very basics of our entitlement program. It's not something which was started by this administration or the last administration. It has been going on literally for decades. But now, in the middle of a recession, it has pressure being brought to bear on a system which really is not sustainable. And as long as we continue to look at solutions that would add more individuals to a government-paid system which doesn't properly fund the full costs of care, you're going to continue to make it more expensive for the private sector to be involved in picking up health care as they have in the past for their individual employees.
You know, it's a fascinating thing that's happening here, because you've got the entitlements that are so expensive, and yet they are not, the fundamentals that require those entitlements are changing so much. We're living longer. We are not retiring at 65. I mean, when you look at Social Security, obviously that has been pushed out a couple of years, but it seems like the fundamentals sort of requiring, and as the backdrop of the entitlements, have changed so much, requiring change of paying out the entitlements. But of course, very few people believe that we'll actually see a substantial change in the entitlements. Is that a fair statement? I know that. Governor Barber, go ahead.
Well, Maria, if we don't see a change and some control, then we're going to be so deeply in debt. I think the figure is by 2020, under current policy, 90% of federal revenue will go to pay interest on the debt that we would be borrowing to pay for these entitlements. And obviously, as you know from what you do for a living, there comes a time when people won't buy you paper.
Yep.
So something's going to happen sometime.
Oh, people have definitely stopped buying papers. Speaking
Maria?
to the technologist in the room.
Maria? I think,
yes.
Over here, sorry. It strikes me as I listen, because having spent most of my career in the private sector, you know, we've all identified cost, and the inflation rate of healthcare costs is the number one issue we all face, whether it be state budgets or businesses, etc. You know, when you look at from a business model, the drivers of cost, the volume, and price. And what we have here is, when you listen to a lot of what's being discussed and some great things happening in individual states.